Going on to the next question. It is true, and it's good to be able to smile at these problems. So, ladies and gentlemen, our Census Bureau estimates that we have 47 million people residing in the United States that do not have health care insurance. However, every one of these people, by federal law, is entitled and is mandated to be able to obtain health care, even if they don't have the money to pay for that health care. Now, what of these 47 million people? We've talked briefly about them tonight. According to our Census Bureau, somewhere between 10 and 20 million of these are aliens, both legal and illegal. An estimated 10 to 12 million of these 47 million people are fully eligible for welfare coverage, full welfare coverage, under Medicaid, CHIP, or other welfare programs. For various reasons, often simply because they're too lazy to go in and sign up, they're not covered under these programs and are considered uninsured. And in the final analysis from the data we have, it appears that there's about 5 million and possibly as many as 10 million U.S. citizens who really can't afford to purchase health care insurance. It's these poor people that really we need to take care of. We don't need to destroy the best health care system in the world to do this. We just simply need to take care of these people. Going on to the fifth question, starting with Dr. Thompson, how do we take care of the poor and how do we take care of the immigrants?
Well, that's a good question, and just to add to the stats there, you're talking about in the neighborhood of 20 million of that population that is listed as uninsured is able, it makes more than $50,000 a year in income. There are insurance options available that are affordable for that part of the population that has just chosen not to for any number of reasons. Again, going back to their choice as to what to do. So when you start looking and breaking down a lot of those numbers that get put out there, especially the headline numbers of 47 million uninsured, it really begs the question of, well, what does that mean? What should we be looking at? Now, in terms of talking about the poor part of the population and covering them and what options are available, again, we have government programs that are available to them. And so the question is that program working? And what programs are available that we can add to that and supplement to help with the uninsured? There are a lot of great organizations from all over the spectrum, from religious to medical organizations that help out that part of the population. And so that, you know, to turn around and say we need to completely revamp our healthcare system for a part of the population, I think really begs a lot of questions that we need to look at. Certainly there are a lot of services that are devoted to that part of the population, and certainly there needs to be more efforts to devote more services there. Does it require a complete overhaul of our healthcare system? I don't think so. I think we do a lot of things really good, really well, that we just, it's a matter of fine-tuning to reach out for that part of the population. So.
Dr. Scioli.
Well, how do you take care of the poor and the immigrants? Well, we are the most generous people in the world. For any one of our politicians to even propose that there is an insensitivity on the part of us as Americans toward the most disadvantaged of us is insulting. It's bizarre. You can't live like that. Nobody in this room lives like that. Now, here's the deal, and this is going to go out on the edge a little bit for you. Coverage must be available and affordable using government subsidies, tax credits, whatever you want to call it, for the poorest of all. And completely government fund as a safety net the poorest of the poor who can do nothing for themselves. And nobody in this room would have a problem with that because it's not that many people. It's that simple. So as they said, why revamp our entire system for that small group of people who need help and who deserve it and who should get it? No one has a problem with that. But here's the premise. The premise for paying for health care should not matter whether you're low income or high income. And follow me on this. It should be the same. Routine care should be paid for out of a health savings account, which should be mandatory for every single person in this country. All right? And you follow me on this, because most people in this room don't know what that is. Catastrophic care, the big cheese expenses, would be covered by an insurance premium. Premiums would be set by age, not by medical condition. There would be a floor and a cap fixed with a minimum contribution of after-tax dollars. The poorest of the poor would be totally funded by the government. All right? And I'll explain to you where those numbers can be in a moment. Now, account holders would be able to withdraw money without penalty for any purpose once a threshold amount has been reached, and at the death, that money is willed to their family. For low-income Americans who can't fund all of their catastrophic premium or minimum health savings account contribution, the government should fill the gap where needed and, if need be, pay the full amount. Now, Mr. Goldhill, in this Atlantic article, this month's Atlantic, you've got to see this. I implore you to go spend about $4 and learn something here. He calculated that if we abolished Medicaid in this country, follow me, the same amount of money that is now spent on Medicaid could use to fund a $3,000 health savings account and a $2,000 premium payment for a catastrophic payment for 60 million Americans. Our president said we got 30 million that don't have insurance. Now you do the math. You don't even need a big old calculator. You don't need your iPhone to go figure it out.
Right on target.
Now listen, so admittedly, and let's call the other side of this, there is a drawback to this approach. Why? Because nobody in this room is used to saving for those reasons. It takes a sea change, and it would take a generation to get this fixed. You would have to slowly phase out Medicare taxes and uptick health savings accounts. But guess what? There's a middle zone there where the government and the insurance carriers could put their smart heads together, and they're going to have to cover our elderly for that window between the sea change, between that paradigm shift, because we deserve that coverage. But the end result will be we will save cost, we will have accountability, and that's how you take care of the indigent, and that's how you take care of you.